Hi everyone, welcome to IsisParenting's Breastfeeding Chat and Learn. My name's Nancy Holtzman. I'm a mom and baby nurse educator and a board-certified lactation consultant and board-certified in pediatrics. I'm here at IsisParenting in Needham, Massachusetts. It's a beautiful sunny day here in the Northeast, and I hope you're having good weather where you are. Joining me today is Cindy Meltzer in the general chit-chat room. She's our moderator, and we'll be facilitating conversation as well as pushing questions to me. I see we have a couple of questions in already, and I'll be doing general questions and answers. And today we do have a special topic, which is nursing strikes. And I think this is a good one to have in the archives because when this happens, it's very distressing for new moms. And a nursing strike is very different than weaning. It's very abrupt and causes both the mom and the baby a lot of distress. I think we'll wait for a couple more people to come in, and I'm going to answer one of the questions, one or two of the questions right now, even though I don't have appropriate slides to share, because as you can see, my loaded slide deck is the one on nursing strikes. But here's a question from a mom who says, I have a 6-month-old, and at our 6-month visit, the doctor told us he can go for 12 hours at night without needing to eat. He currently eats once in the early morning hours. Can you give some suggestions on night weaning? We've also just started increasing his solid foods during the day, which already seems to be helping him sleep better, and he nurses every 3 hours during the day. Okay, so baby is 6 months, and the pediatrician says baby can or should, I'm not sure which, go 12 hours at night. Right now, it sounds like this little one is going down to sleep, and then I would suspect is probably waking up sometime around 3 or 4 o'clock in the morning to nurse, and then hopefully go back to sleep. That is a very normal feeding pattern for a baby between 6 to 8 months old or so, and it's quite desirable because both mom and baby are able to get nice long chunks of sleep. Even though the pediatrician says the baby may be able to go 12 hours at night, the baby may not feel like he can go 12 hours, and that's a really long time. 7 p.m. to 7 a.m. is 12 hours, and I know I definitely both eat and drink sometime between 7 p.m. and 7 a.m., usually both. And, I think it's one thing to say metabolically or calorically, this baby doesn't need it, but it's really, that's a big expectation to make on a little baby who's not naturally inclined to have a pattern like that. Plus, it actually really requires a lot of calories and nutrition during the other 12 hours of the day. So you may feel like, every 2 hours it's either time to nurse or give solid foods again. It's just cramming a lot of calories and nutrition in the waking hours. So one more reason why it's not such a bad thing to nurse once at 3 or 4 a.m. is because that's very good for your milk production, and it's probably going to keep you comfortable because chances are your body is not going to let you go 12 hours without lactating and releasing milk. And then finally, if you have not had your period return yet, by starting to skip that 3 or 4 o'clock feeding, you'll probably get your menstrual cycle back. So I guess I might just suggest sticking with that pattern a little bit longer. And if at 7 or 8 months your baby is still up once or more at night to feed, and that's starting to be distressing for you, then you could explore other types of gentle night weaning. But I think for a 6-month-old who's sleeping a 12-hour stretch with one feeding stuck in the middle, or in the early morning hours, I think you can give yourself a good pat on the back, and things are going pretty well. Okay, I'll take one more question, and then I'm going to get to the topic at hand. Here's a question. Hi, Nance. In the past, I've heard you say that when a baby starts solid foods, they should still get most of their calories and nutrients from breast milk. How long should that be the case? My son is 8 months old and now sits down for solids, typically 3 times a day. He's loving proteins and eats quite a bit at times, but is still drinking the same amount of milk. I know every child is different, but is there a rule of thumb regarding how much he should be getting? It sounds like you're doing beautifully. So you're offering 3 meals a day and allowing him to eat as much or as little as he chooses. You're offering and facilitating the solid foods, and you're probably offering a nice variety of fruits and vegetables, whole grains and carbohydrates, and now proteins, it sounds like, and dairy. If you haven't introduced yet, you can introduce dairy, and then continue to offer to nurse. Now, some people may do four for breastfeedings or breast milk bottle feedings in a 24-hour period, and others may be offering milk twice or three times that volume. That's a parenting style. But as long as your baby is growing, gaining, and thriving, you can trust that he's getting a good blend of breast milk and dabbling in solid foods. And some babies will take more like 75% milk and 25% calories from solids, and others may reverse that and progress very quickly or sooner to eating a larger volume of solid foods. And so they may just be taking, for example, 30 or 40% of their nutrition from breast milk. What's important really is that the baby is content and growing and gaining well. I do have a full webinar on feeding your baby from 6 to 12 months that goes into this in a lot more detail, so that might be helpful for you. Okay, so let's see, looks like we've got a full house here, and I'm going to move into talking about nursing strikes, and then I will come back and answer all of the other questions that are coming in. So what is a nursing strike? A nursing strike really is different from weaning because it happens very abruptly and very acutely. And a nursing strike it can happen at any point, but I would say is most common sometime around 6 to 12 months, and then could also occur for an older baby as well. There usually is a reason. It's not a random occurrence that just crops up out of the blue. You may not be able to figure out what the reason is initially or even ever, but almost always a nursing strike has some sort of a precipitating factor. And the most common reason that babies will probably go on a nursing strike, there's probably 3 or 4 very common reasons. And one common reason is an illness. And so one of the first things I'll ask moms when they say that the baby has abruptly stopped nursing is, has the baby had a recent cold? Because ear infections are a very common reason for a baby to fuss or refuse to nurse. And sometimes a baby with an ear infection will nurse in one position but not nurse in another position, or they'll nurse on one breast but not on the other breast. And that's probably due to a certain position, and when they're sucking in that certain position, it causes pain in the inside of the ear. As I'm often reminding moms, a young baby is not going to tug on their ear and tell you that they have an ear infection, and a baby who's otherwise relatively happy pulling on their ear does not mean they have an ear infection. Babies are not good at showing you where it hurts, and so tugging on the ear or not tugging on the ear really doesn't factor into ear infections. Ear infections are most common following an upper respiratory infection. So if a baby has had a lot of coughing and sneezing and thick yellow or green mucus, often a couple of days later, you'll begin to see some behaviors or symptoms that make you wonder if the baby has an ear infection. And sometimes babies will have a fever, could be a low-grade fever. Sometimes babies will seem relatively okay during the day, but then be very distressed at night, not want to lie down, not want to sleep, keep waking up when they're sleeping, and often refusing to eat. Another reason why sometimes babies will refuse to eat is if they have a viral infection that's causing a sore throat or swelling in the back of the throat. And unlike adults, a lot of babies, after they have a virus, will actually develop a body rash and sometimes sores in the mouth or the throat. Other viral illnesses specifically target the mouth and the throat. So things like Coxsackie virus, which is also known as hand-foot-mouth disease, causes little lesions or sores in the mouth and the throat, and it makes it very, very uncomfortable for the baby to swallow. So one of the first things I do ask about is the baby acting unwell? Have they had a cold recently? Is there a fever? Because a virus might be something you would suspect. Another very, very common reason that babies will go on nursing strike is relating to teeth. And it's usually not the front teeth that babies typically get sometime between 5 to 8 months old. Often it's the side teeth or the molars that cause a little bit more distress. If you think about the front teeth are really sharp and angled, and so even though we attribute a lot of baby behavior to teething, I think a lot of times it's kind of overrated. A lot of babies that are having sleep disruptions at 4 months, it's usually due to a sleep association and developmental changes, and is often best managed from a behavioral standpoint, and it's not often related to teeth A lot of parents are sure it's related to teeth because that's at the same developmental stage that the hands are going in the mouth constantly and the baby is gnawing on everything and chewing. And yet it still could be 2 or 3 or 4 months before you ever see that first tooth. So I'm quite skeptical of babies that are 4 months old that night after night after night after night after night are having sleep disruptions that parents call teething. And typically it's not related to teeth. And teeth discomfort usually only lasts for a couple of days. It really just takes 2 days between when you see a slit in the bottom gum line before that tooth emerges through. So if it's going on for 4 or 8 nights, it's behavioral and not teeth. But sometimes what happens when babies are getting teeth is that the side teeth sometimes cause referred pain to the ears, but also when babies are actively cutting teeth, they tend to be very nippy, and sometimes they will bite down while they're nursing and playing around at the breast. And sometimes moms inadvertently have a very, very strong reaction, also known as shrieking. Because it comes out of the blue, maybe you're relaxed, and then all of a sudden you have this needle-like pain, a baby is biting down into your nipple with a sharp tooth. It really hurts. But sometimes, unfortunately, what happens is that startles the baby, scares the baby so much that the baby then is afraid to come back to the breast again. So I would encourage you, if you know that your baby is in an active nipping, teething phase, to nurse in the cross-cradle position, because then you have more control over what the baby's head is doing, and to proactively end the feeding yourself so that you're not letting your older baby kind of hang out and play around and pull on and off the breast at the end of a feeding. So just end the feeding when it seems like the baby is starting to slow down, when you know your baby's in a nippy phase. And then in the cross-cradle position, you've got your hand supporting the nape of their neck, and if they do bite down toward the end of the feeding, you can use your hand to smush their face deeply into the breast tissue, so their mouth and their nose are covered with the breast, and babies will very, very quickly respond by opening their mouth wide to get some air. So when they open their mouth wide, they release the nipple, and then you can take the baby off the breast. And at that point, just say very clearly and firmly, no biting. Biting hurts. Without being very, very dramatic or yelling. And for an older baby, maybe after 10 or 12 months old, if they bite a second time, I would do the same thing over again, but you can even take an extra step, which is to put the baby down on the floor and get up and walk away. And they will melt down. That really upsets them. But what you don't want to do is have a very, very strong instant reaction when they're at the breast. You don't want to yelp or shriek or otherwise scare the baby. Okay, so that's another common cause of a nursing strike, teething. And then sometimes after babies will have vaccines, they will have soreness, and being in a certain position can cause discomfort nursing. And so same thing, sometimes it will be that they'll nurse on the right breast but not on the left. And I'll ask, has the baby had vaccines within the last couple of days? And if you've had a flu shot, which I hope you get every fall, but when you have a flu shot, sometimes it may feel like your arm, like somebody punched you in the arm and your arm is tender. So when a baby gets their shots in their thigh or even in the upper arm, you can see this nursing position here. If the baby is putting their weight on that spot and that spot is uncomfortable, it may make them fuss and refuse to lay in that position. One reason why I included this photo of the baby nursing in that cradle hold is if the baby will take one breast but not the other, and in this picture it looks like the baby is latched to the right side, instead of turning the baby over as you usually would to nurse on the other breast, imagine just sliding that baby over about a foot, so you could put a couple of pillows next to you on the couch, and imagine just sliding the baby in the exact same position over to the other breast. So they're approaching the left breast and the exact same position they are nursing in the right breast. And sometimes that's actually a very nice trick that works if the baby will nurse on one side and not the other. Another common reason why a baby may go on a nursing strike is if mom has been away for a few days. Maybe parents took a weekend away for their 10th anniversary, or maybe a business trip or something like that. And so, especially for an older baby, if mom is gone for, for 3 or 5 days, sometimes when moms come back, sometimes there's no difference at all, and the baby is perfectly happy to just come back to breast and nurse, very, very delighted to see mom back. And other times they may not. And so part of that may be related to the frequency of bottles, and part of that may be related to mom's milk supply. If the baby is getting lots of bottles where the milk flows very quickly and easily, and then they come to the breast and they have to work very hard to get just a little bit of milk, they may lose patience. But again, that's a little different than a nursing strike, because a nursing strike is very, very abrupt. It's not a gradual tapering, it's more of a adamant refusal. Okay, less common, but still something to put out there, is when milk production decreases due to hormonal reasons, or a difference in the taste of the breast milk, or a difference in the smell. So even though these are a little bit less common, other things we'll often ask moms if she says that suddenly the baby's refusing to nurse. Did you change your deodorant? Did you use a new kind of soap or body lotion that has a certain type of fragrance to it? Are you on any new medications? They could be medications that change the taste of the milk, or they could be medications that decrease the milk production dramatically. So a good example of that would be a decongestant like Sudafed, which can have a big negative impact on milk production. Any medications that contain estrogen, like standard birth control pills, or estrogen-style birth control. Also, in the days before you have your period, you may notice a dip in your milk production. And then, of course, a pregnancy over, typically sometime around 4 to 8 weeks of pregnancy is often when moms will notice that they have a decrease in their milk production. So these are other reasons why the baby may have negatively interest in breastfeeding. But regardless of the reason, we're going to talk about how to cope when a baby suddenly refuses to breastfeed. And usually these are not very young infants. So, typically a nursing strike is not a 2-month-old or a 3-month-old baby who's crying at the breast and takes some coaxing to nurse, although many of these tips may help as well. A nursing strike is more typical. A baby that's 10 months old that bit down on mom, and mom shrieked, and now every time the mom puts the baby in the nursing position, the baby starts crying. That's more of a typical scenario. So a couple things. First, you want to treat any potential pain, any congestion. If a baby has a very thick, stuffy nose, they're not going to be able to eat and breathe at the same time. So helping relieve some of the nasal congestion can help. And handy things for that are the nasal saline drops. You don't want to spray saline in their nose, but you do want to drip it in there. And then you can use the bulb syringe to draw out the now thinned mucus and saline together. And a humidifier can help as well with congestion. If you think that the baby is uncomfortable because they have a virus, they have a little fever, maybe they're cutting a tooth actively, then for 48 hours, you certainly can medicate them with Tylenol or with ibuprofen, as long as your pediatrician has given you approval for that and you know the correct dosages, which is based on your baby's weight. If you're really not sure what's going on, it's usually okay to give your baby 2 doses in a row. For Tylenol, it's usually 4 to 6 hours apart. For ibuprofen, it's usually 6 to 8 hours apart. So as long as your pediatrician has given you the approval to use a infant pain reliever, then you can try using Tylenol or Motrin and see if the baby seems more comfortable. And often, if the baby's more comfortable, they're more likely to nurse. If this has been going on for 12 or 24 hours and you just don't know what's going on, but the baby is adamantly refusing to nurse, it is worth a visit to your pediatrician to have them checked out. Check the ears, check the throat, check to make sure that there's not some sort of a diagnosable situation going on that they can give you some answers for. In the short term, when you're working to resolve a nursing strike, you must keep the milk moving. So if the baby is not nursing or not nursing regularly or well, you still want to be expressing that milk. Number one, so you've got the expressed milk to feed the baby in another way, but number two, so that you can begin to coax and coach the baby to come back to the breast and have plenty of payoff at the breast when he or she is willing to work back on nursing. In general, I would suggest not giving the baby other things to suck when you're working on a nursing strike. So in general, that means no pacifiers and no bottles. It does not mean don't feed the baby, and I'll talk about that in a minute. But if possible, you want to avoid using bottles and pacifiers so that the baby's sucking needs are not being met elsewhere. The baby can still get nutrition and food and hydration other ways, but keeping their drive or their urge to suck by offering the breast as that resource. If that's not feasible for you because, say, for example, your baby is 7 months old and in daycare and the baby does need to get bottles, then make sure you're using a very slow flow bottle nipple so that you don't get into that situation where the milk comes quickly and easily from the bottle and then they're protesting nursing even more. So in general, I would recommend staying away from the pacifiers and certainly avoiding bottles if the baby's refusing to nurse, because when a baby screams at the breast and then you follow up with a bottle, that is very quickly a downward spiral, or certainly can be. But again, sometimes it's just not practical to give no bottles if there is a nursing strike, especially if the baby is young or in daycare. But when it is feasible, remember that there are many other ways of giving breast milk and many other ways of giving food and fluids to keep your baby healthy and hydrated and nourished while you're working out the issues of the nursing strike. I would encourage using cups rather than the bottle for a baby that's able to take a cup. So whether it is a sippy cup or a straw cup, again, even with a sippy cup, they're not going to be getting their sucking needs met. They'll be able to get water or expressed milk, but they won't be, sucking and sucking and sucking and dozing as they would with the breast or with the bottle. If your baby is younger and isn't eating a lot of solid foods or drinking from a cup, if a baby is actively cutting a tooth, one thing you can try is making a breast milk slushy. So you can use some partially thawed breast milk and spoon feed that, and that is, like an Italian ice. Some people call that a momsicle. But using the breast milk in a slushy form and feeding that by spoon. Another thing you can do if your baby has started solid foods is to feed your baby lots of whole grain cereal mixed with the milk as a way of getting an ounce or two of breast milk and some nutrition in without needing to give a bottle. You want to make sure that your baby is staying healthy and nourished and hydrated. Starving the baby out is not a good plan to resolve a nursing strike. If your baby is eating solid foods, remember that most solid foods are 90% fluid, and things like peaches and pears and green beans and carrots are mostly water. So they're going to get hydration as well, and you want to diarrhea when you're monitoring a baby for dehydration. The bare minimum you always want to look for is 4 wet diapers in 24 hours. But that is, kind of the minimal. So a healthy, well-hydrated baby is going to be wetting 6 wet diapers in 24 hours or more. But how do you really work to resolve a nursing strike? And so we've talked about why they happen and how to keep the milk flowing and how to nourish and feed your baby in the throes of a nursing strike. But what do you actually do to help resolve the nursing strike? And, it's a really hard and distressing thing. And I'm going to share these suggestions, which are very common suggestions. But the reality is that, I don't have a magic answer. There's no magic wand that we can just say, poof, we'll resolve this nursing strike. The good news is usually you can bring the baby back to the breast, but it may take a few hours, it may take a few days. Sometimes you have to resolve the situation. If the baby had an ear infection, for example, you need to provide pain relief, and hopefully the ear infection is going to heal in a day or two, and the baby's going to be more comfortable and back to the breast. Meanwhile, you've kept your milk supply up, Meanwhile, you're feeding your baby well and keeping them hydrated and nourished. But what are the things that you can do to help bring the baby back to the breast? Well, skin to skin is a classic example, and without pushing or having the uh, without constantly pushing the baby to nurse. So you don't have the expectation that that letting your baby nap on your bare chest in just a diaper is going to automatically make the baby nurse. No, but at least you're putting the baby at the table, and the skin to skin is beneficial for both of you for so many different reasons. But sometimes when the baby is in that sleepy, drowsy state, whether they're either asleep or just half awake, so they're either falling asleep or just waking up, very often that's when babies that are in the middle of a nursing strike will nurse. So it's very common that a baby is refusing to nurse during the day, but will nurse at night when they're very drowsy. Um, Carefully sharing a sleep surface without your shirt and being available to your baby at night will help resolve a nursing strike too, especially, as I said, if you catch them before they're fully awake, they may be willing and they may latch on without remembering that you shrieked yesterday when they latched, and now they're afraid to nurse. So they're half asleep and they're going to be more likely to latch on. Wearing your baby and keeping them close to you is going to be good for both of you. And then what's a very nice suggestion for all moms and babies, or dads and babies, but also helpful in a nursing strike, is what's called co-bathing, or taking a bath together. This mom looks awfully happy. I don't think she's in the middle of a nursing strike, but I will tell you that getting into the bathtub with your baby is a really, really pleasant experience. And for some babies that are having nursing difficulties or a nursing strike, they're very relaxed in the water. And the breast is in proximity, and sometimes that works too. But even though, again, I'm sorry, I have no magic solutions for you. These are very standard solutions. The truth is, often these are what work best. So skin to skin, taking naps and sleeping right next to your baby, wearing your baby in a sling or a carrier, taking baths together, hopefully will resolve that situation. And usually it is temporary. So it may be an afternoon or a 24-hour period, and sometimes, unfortunately, it's longer. Sometimes a nursing strike will go on for 2 or 3 days. And the question I'd like to put out there, is a hard one to answer. How do you know when it's enough? When do you throw in the towel? When do you give up? And I don't have an answer for you to say, after this many days or after this many weeks. It really depends on how you feel and the age of your baby. And I really want to talk a little bit more about this, because you may find that you're not getting a whole lot of support and understanding, especially if your baby is older. Here in the United States, people breastfeed for 3 months or for 6 months. If you're breastfeeding for 9 months, some people think that's a really, really, really long time. And some moms are planning to breastfeed for a long time, and they plan to breastfeed into toddlerhood, and all of a sudden to have their 9-month-old baby refuse to nurse and scream abruptly every time they come to the breast, and then to go to the pediatrician or talk about it to their mother-in-law and say, my baby's refusing to nurse, I have to go home, I have to pump, I need to work on this. And people might say, oh, your baby's 9 months old, you've breastfed for so long, aren't you ready to be done? Or maybe your baby's just ready to be done, maybe he's weaning. That's not the answer that you're looking for. And I think especially when your baby is even older, if they're over a year old, a lot of people will say, well, you breastfed for a year anyway. Now your baby can have cow's milk. Why are you so upset about this? And you have permission to grieve. This is not what you were looking for in terms of your nursing relationship. A normal, typical weaning, a baby-led weaning, is going to be slow and gradual, and it's a mom can initiate weaning at any point that she chooses, but typically babies themselves don't initiate weaning unless you're offering lots of bottles as an alternative. A baby doesn't decide just to stop nursing if there's nothing, if there's not another source of milk typically available. And probably it's much closer to 2.5 years old is a more typical age of biological weaning. So I know that that's very unusual, and probably some of you may be very surprised to hear that. It's not the typical experience here in the United States, but giving a baby lots and lots and lots of bottles as a mom's milk supply begins to decrease, and then having the baby gravitate and be more interested to bottles rather than the breast is often how women in the United States experience weaning. But that's, whether you mean to or not, you are actively weaning the baby. So sometimes moms are very upset at the way the weaning, this type of weaning occurs when it's precipitated by a nursing strike. It's not gradual, it's out of the blue, it's abrupt, and often mom is expressing milk and feeding the milk by cup or by bottle to the baby and is wondering and looking for support as to how long she should continue doing this. And remember, that every ounce of breast milk has value, and it really depends on what you're going to feel okay about long term. So, if your baby goes on a nursing strike for 3 days or 5 days, and, a lot of moms are just going to kind of, stick it out and continue to express milk and hope and work on having the baby come back to the breast. Sometimes if that goes on for 2 weeks or 3 weeks or 4 weeks, depending on the age of the baby, moms may need to grieve a little bit and come to terms with the fact that it's possible the baby is not going to come back to breast. And then she needs to decide, well, the breast milk has value. So, if my plan was to breastfeed for 15 months, for example, will I continue to express milk for another 2 or 3 months to give my baby that gift? And her answer may be yes, and another mom's answer may be no. So I can't answer that for you, but I will tell you it can be hard to find the support and the answers because a lot of people, may not understand why you're so distressed that your 14-month-old suddenly stopped nursing. So it's okay. It's okay to acknowledge that this isn't the end of the way you want breastfeeding to wrap up, and to really celebrate each stage of breastfeeding and the breast milk that you're able to give your baby. And I just put that out there because it's such an emotional thing for moms. But realize that most of the time babies will come back to breastfeeding. Okay, I'm going to, I think I'm almost done with this topic. I've got 2 more slides to go through with you, and then I'm going to answer all these questions. We've got plenty of questions, and I'm going to try to get to all of them. So I'm changing gears a little bit. I wanted to let you know that this Saturday, June 2nd, for those of you in the greater Boston area, this is a newly released book that you may have heard of, and that's called The Other Baby Book, and it's focusing on natural parenting, some attachment parenting philosophies. There's a lot of very nurturing approaches. It's written in a very mother-to-mother tone. These are the topic themes here, and I did help edit the breastfeeding chapter, and I have a page in there as well that I wrote. And we're going to do a book signing here in Needham with the 2 authors, Megan Musaro and Miriam Katz. They will be here, and there'll be some giveaways and a party and refreshments and so on. So if you're in the Metro Boston area, I'll be here as well as the authors of the book, and we would love to see you. And I'd love to see your babies. And next Thursday, the topic is going to be weaning. So again, nursing strike is not really the same thing as a weaning. So next week we're going to talk a little bit about how weaning happens, intentional and unintentional weaning, and how to help your baby wean in a nurturing and gradual fashion if that is your focus. So sometimes for a variety of reasons, moms do want to know, my baby is 3 months or 6 months or 9 months old, and for whatever reason, I need to or want to wean at this point. So how do I go about substituting 1 bottle for a breastfeeding, and what do I need to give formula? If my baby is 10 or 11 months old, do I give cow's milk? What about when my baby is older, and so on. So we'll talk about weaning next week. Put it on your calendar. Tell your friends. We're here every week, and we're always trying to get a nice national and international crowd so that we can validate our existence. Right, Cindy? Let's see. Cindy, would you be so kind as to change the deck for me? And I'm going to go to the next question. Let's see. I hope that was helpful. Let me take a deep breath and look at the quick look at the, oh, co-bathing. I see Kara is a fan of co-bathing. Oh, is this Kara with the twins? I bet it is. Yes, and I will tell you, I really enjoyed taking baths with my babies, and it's so fun, and especially if your baby is a brand newborn, seeing them, fill up your tub nice and deep with warm water. Don't make it lukewarm. Make it nice and warm. Get in the tub, and then have your partner hand you the baby. And if your partner's not home, what you can do is undress your baby naked, and then put a couple of towels in the car seat, and lay your baby in the car seat next to the tub. Then get into the tub yourself, sit down in the tub yourself, and then reach over and pick up your baby. Because what I don't want you to do is climb in and out of the tub holding your baby. Tubs are very slippery, and that's a dangerous thing. So if the car seat is right next to the tub, and then when you're finished taking your bath, you can put the baby on top of the towels in the car seat and then fold the towels over so your baby's warm and cozy, and then you can rinse yourself off and stand up and get out of the tub yourself, and then nobody slips. But especially for a newborn, you'll see it's a real photo moment. Their eyes go wide and their arms go out and they make little swimming motions. And for a very young baby who screams in the little infant tub because only their bottom half is nice and warm and their top half is cool, they really love being in the deep tub. And let me suggest that for partners, for dads, for the non-nursing partners, it's a really nice way of bonding and getting that delicious skin-to-skin time together. If partners feel funny about being in the tub naked with the baby, you can wear your swim trunks. But it's a really, really enjoyable experience, and it's a very easy way of getting your baby clean and as well. Okay, here's a question. My 3-week-old is nursing every hour to hour and a half during the day. She's gaining weight well and goes a bit longer at night, 3 hours. Should I try to get her to space out her feedings more during the day? I fed her 15 times yesterday. Okay, so your baby is 3 weeks old. Congratulations. When you think about a brand newborn, in utero, they have, I hate to say it, they have womb service. So they're getting fed 24/7. They really it's almost like a continuous IV of nutrition, and they don't experience hunger, and they don't experience being full, and they don't experience being uncomfortable or being cold or being hot. They don't experience the bowel sensations moving through them, and they don't experience gravity. And there's always white noise, and they're always moving a little bit. So they're rhythmically rocked a little bit, and even when you're sleeping and not rocking, the uterus massages them a little bit and applies pressure to the top of their head and their bum. And so they're always feeling warm and contained and not hungry. And so when they're born, let me find a nice slide. When they're born, all of a sudden, for them, it seems like a really big adjustment where instead of being fed 24/7, now your baby has to shift and only eat 15 times a day. I think what I would suggest is trying some other things in between feedings a couple of times a day to see if the feeding it may well be that the feeding is the happiest and most comfortable way for your baby to pass time, because at 3 weeks she just doesn't have a lot of hobbies. But these types of things are very normal. So newborns have intense sucking needs. They typically will only sleep when they're being held or moved, and so using a sling or carrier is going to be helpful. A lot of moms find the baby falls asleep at the breast, and then as soon as you try to swaddle them or put them down, within a little while they're back awake and crying again until you put them back to breast, because young babies essentially do 3 things. They eat, they sleep, or you need to be actively involved in keeping them from crying. So a 3-week-old is typically not going to spend a lot of time awake and looking around and cooing happily at the mobile, and they're probably not going to spend a lot of time sleeping contently all by themselves on a firm, flat surface. So that's what the books and the media lead us to believe a baby should be doing, sleeping for 3 hours in the white eyelet bassinet in between feedings. But the reality is a little bit different. So it's normal that your baby wants to nurse constantly and only wants to doze when they're on you or next to you. And it's normal that your baby will sleep as long as you have them in a sling or carrier or keep them moving. And then as soon as you stop movement or put them down, they wake up and cry. It's also common to cluster feed. So babies may want to eat 3 or 4 times over a 6-hour period and then may crash and sleep for 3 hours. And of course, eating around the clock, because 3 o'clock in the morning means nothing to them. It could be 2 o'clock in the afternoon, 2 o'clock in the morning. It's all the same. So those are very typical normal newborn behaviors. There are some things that can help. I don't know if you're in the Boston area, but if you are, I would highly recommend the Great Beginnings New Mothers groups. Otherwise, I would look for breastfeeding support groups and new mothers groups that focus on moms and brand newborns. To learn, hopefully it's part of the curriculum like it is here at ISIS, but to learn a lot of information about soothing and settling techniques, normal newborn behavior, some things that really do work, like learning how to use a sling or carrier, the vestibular motion, which is like a switch, certain types of movements, sitting on one of these blue physio balls in the back and bouncing rhythmically will help lull a baby very quickly and easily. If you can pair that with a sling or a carrier, your hands will be free and your baby will be happy. Learning how to swaddle snug when the baby is asleep, so that if you're trying to put the baby down on a firm, flat surface to sleep for an hour or two, you'll have a better bet at that working if they're swaddled snugly. So I would encourage you to feed your baby just as you're doing, but then a couple of times a day, put your baby in a sling or carrier and go out somewhere. Go for a walk, go on a ride in the car. Go do something. Go do an errand. Take the baby in the stroller or in the carrier and see if just keeping your baby on the move for an hour or two does help settle them. It's not unusual, though, for babies to feed that frequently. As long as your baby is growing and gaining and you're not sore, then you can assume that things are going according to plan, and the baby probably is going to become more of an efficient feeder over time. I would recommend, when the baby is at the breast, watching carefully to see that the baby is actually transferring milk, and doing a lot of breast compression and little gentle pokes and prods and taps when the baby starts to fall asleep, because that will make the time that the baby is at the breast more efficient so that they actually are drinking milk. And then, I would want to, if you're just nibbling every hour, it's not unusual that you would be hungry again an hour later. Now, lots of newborns want to eat, every hour or two. That doesn't mean that something's wrong or you're not doing it right. But certainly if the baby comes to the breast and pretty quickly falls asleep as soon as a little bit of milk hits their belly, and then they stay at the breast nursing and dozing for 45 minutes, and then you put them down, I'm not surprised if half an hour later they wake up again and want to nurse again. So if you can maximize the amount of milk that they transfer at the breast, it may mean that a given feeding session may be a little bit shorter, or it may mean that they're able to go an hour or two before the next feeding. So those are some things to try. We'd be happy to see you. You could do a lactation consult so we can kind of see what's going on at the feeding. But those are some things I'd be thinking about. Okay, here's a mom whose baby is, I just want to see how many weeks old this baby is, how many days or weeks old. I know this mom just had her baby, 6 days old. Okay. I am painfully engorged in one breast, and my baby has a hard time staying latched on. I am afraid pumping will only make me produce more milk and worsen the problem. My baby's 6 days old. Any suggestions? Yes. Yes, in the long term, you don't want to get into a situation where you become pump dependent by artificially creating so much more of a demand than the baby needs. But in the short term, when you're 4, 5, 6 days postpartum, as you said, it can be very hard for the baby to latch when the breast is very hard. My analogy is imagine that your breast is like a beach ball with an M&M glued to it, and then cover the whole thing with olive oil and try to latch onto that bad boy. And if the baby even can get a grip, they're probably gonna clamp their gums right around that M&M and hang on for dear life. And so you can see how when your breast is very hard and firm, the nipple begins to be less flexible and protrude a little bit less. and it's harder for the baby to latch on, and then everything gets all slippery with the baby's saliva and a little bit of the milk, and it's very tricky. So I do think that it would make sense to do some expression so that you can soften the breast a little bit, will help the milk flow a little bit, and help your baby latch on a little deeper. And when they can latch on a little deeper, they're going to do a better job at removing and releasing some milk. Another thing to remember is that when you do have engorgement, it's not just milk that's in the breast. A lot of people think that when the breast is big and firm that way, it's full of milk. Well, it does have milk in it, absolutely, but it also just has a lot of edema. So especially if someone had an epidural and they had a couple of liters of IV fluid and swollen ankles, about 3 or 4 days later, all of that extra fluid shifts to the breast. And so there's a lot of extra fluid and swelling there too. So just like if you had a swollen ankle, you elevate that and you pack it in ice and you use an anti-inflammatory. And that's another thing I would recommend. So I would use like a hot washcloth, warmth before, then express a little bit, and then nurse, and then express afterwards, and see if you can get the breast feeling softer and more comfortable. And then once you do, pack it in ice. So take a few bags of frozen vegetables and put that on your chest. It will probably feel good once you soften the breast a little bit, and that will prevent more swelling. And then take some ibuprofen, Advil, or Motrin. Check with your healthcare provider. Usually they discharge you home from the hospital with that. Typically 600 milligrams every 6 hours or so with food would be a typical dose, but again, check with your doctor. Okay, next question. I'm a little concerned about being able to keep up with pumping enough. I'm currently giving a 7-ounce bottle at his last feeding, but now also need to use pumped milk with his cereal. I was pumping twice a day. Should I go up to 3 times? Okay, this happens to be the same mom who was asking about the baby sleeping 12 hours at night. And 12 hours is a really long time to go without nursing or pumping. So maybe you're pumping before you go to sleep. I'm not sure. But 7 ounces is also a large bottle feeding. I probably would not go beyond that, and you could even back up a little bit and see how the baby does with 6.5 or 6 ounces. But in terms of using pumped milk in the cereal, if the baby is getting plenty of breast milk and you're starting to introduce solid foods, and then in another couple of weeks or around 7 months or so, you can introduce yogurts and dairy foods. You don't necessarily need to use breast milk for the solid foods or for the cereals. So you could mix that with water or with pureed fruit, for example, a whole grain brown rice or oatmeal mixed with mixed with water and a spoonful of bananas, for example, would be fine. But I think you just want to make sure that that you're keeping up with his needs, whether you're breastfeeding directly or you're expressing milk for the bottles. But don't worry too much about extra breast milk for the solid foods, because you don't always need to give cereal with breast milk. You can give cereal with other things. Okay. And not everybody gives cereal all the time as well, as you know. So sometimes bananas or avocados, protein foods gradually are going to be introduced. But cereal is it's a filler, and I mean that both as a pro or a con. It is a good way of getting extra calories into a baby that needs extra calories. It's fed alongside a fruit or vegetable, and it's more. Fruits and vegetables are mostly water with a little fiber, a little vitamin A, and a little vitamin C, whereas the cereal is going to be a little bit more stick to the ribs. But I do recommend using one of the whole grain infant cereals like oatmeal or the brown rice cereal, because it's going to have a lower glycemic index. It's not going to spark the blood sugar and then drop the blood sugar. And I think there's a lot of understanding now about highly processed white grains and insulin receptors and things like that. So I would put in a request for the brown rice cereal or the oatmeal as a whole grain. Next question. I plan on breastfeeding for at least a year, and I'm trying to keep my supply up. I keep on hearing other moms say their supply has dried up months into breastfeeding. What causes them to lose supply? Is it due to something they have or have not done, or does it occur inevitably? How do I ensure I'll have enough supply for a year? That is a great question. Breast milk does not just curl up and go away unless you get pregnant. And in fact, there used to be people who were employed as wet nurses, and they would have a baby, and then they would produce milk for 2 or 3 years or longer. And as long as you continue to remove milk thoroughly and frequently, your body will continue to make it. As long as you don't add estrogen to the mix, and that would be through pregnancy or through medications. The best way to make more milk is to remove milk thoroughly and frequently. And when I teach the pump talk class, this is what I talk about in terms of expressing milk frequently in the workplace, because it's not going back to work that decreases your milk production. It's going back to work but not pumping frequently enough to maintain milk production that does it. So as long as you are either with your baby and nursing or away from your baby and expressing, you will continue to make milk. Let's see. Common mom issues which may lead to lower milk production. So unresolved engorgement, that's my pumpkin lady. When the baby begins to sleep longer at night and mom is not expressing as often. And again, there's something, we believe there's something pretty special about the middle of the night nursing periods. We know that nursing at 2 or 3 or 4 o'clock in the morning actually does some valuable things to your prolactin levels, and a lot of moms will continue to be able to produce milk for a long time, even, and I'm talking about 18 months, 24 months, even though the baby may only be nursing 2 or 3 or 4 times a day, as long as she's nursing and removing that milk thoroughly. So when your baby begins to sleep longer at night, make sure, number one, you remain physically comfortable, and make sure that that you're not getting engorged and uncomfortable, and slowly begin to teach your body to go a little bit longer at night. So if the baby is not waking you up but your breasts are, if you do need to pump but you want your body to begin to adapt, you can pump but not pump as thoroughly. So you can pump just to relieve some fullness, and then let your body slowly adjust. But if you continue to go at work or at home, pumping less and nursing less, over time your body's going to make less milk. Now, if your baby's getting older and they're eating other things as well, that's okay, because they need less milk as they get older. But in the short term, if you have a 6-month-old or an 8-month-old, if you don't want your milk production to decrease, then you want to be removing milk as often as your baby is needing milk. So when you're apart, that means pumping. Okay, let's see. I think we have one more question and time for one more question, so that's good. Let's see, hold on. What's this one? Do I have any suggestions for how to wean a baby? Okay, I do, and that's what we're going to talk about next week. And I think it really depends on how old your baby is, too. Let me see if I can see how old this baby is. And it depends it depends who's initiating the weaning as well. If mom is initiating the weaning, then it would be substituting if the baby is younger, a bottle feeding for the breastfeeding. I would probably start with the feedings that seem easier to drop or less significant to your baby. So probably a middle of the day type of a feeding would be a good one to substitute for a bottle feeding. Often as weaning progresses, it's usually the pre-nap and the pre-bedtime breastfeedings that are the ones that last the longest. So sometimes moms will decide that she wants to stop pumping. Maybe the baby is 10 months or 12 months old, and moms will gradually begin using frozen breast milk from the freezer or infant formula, or if the baby's over 12 months, they'll use cow's milk plus solid foods, stop pumping at work, and may continue to breastfeed just once or twice a day, as long as her supply seems to maintain that and the baby maintains interest. So a slower and gradual weaning is going to be easier on your body and easier on your baby's digestive system and easier for everybody to adapt. But I'll cover that in more depth next week. So let's see, it's time for us to wrap up, and please do, if you're in the Boston area, come along on Saturday and say hello to me and meet the authors of the other baby book. And please do come back next week for Breastfeeding Chat and Learn, where we'll talk about how weaning happens and answer all of your questions and answers as well. You can join me on Twitter at Nancy Holtzman. You can join Cindy on Twitter at Cindy Melts, and you can join IsisParenting on Twitter at ISIS_parenting. And like us on Facebook, because Cindy posts a question of the day every week, and we'll be happy to see you back next week. Have a great week and happy nurturing, everyone, and thank you for coming.